All right, so we've made it to the last lecture of the first chapter. So, in this lecture, I'm gonna give you an assignment from the book, and then we will get to work talking about some very specific anatomical terms. And so, let's get just hopping right into it. So here's the assignment. On your own, you need to read the section of the chapter that discusses the 11 body systems, the organ systems, and I want to really encourage you to use active reading techniques. We talked a little bit about this. I think we did. Maybe we didn't. So if just in case we didn't, active reading means choosing a time when you are at your very best and getting things so that it's quiet and you can focus and concentrate, and then sitting down with the book and reading through it, and then using, either taking notes from it or using a computer, you can type up notes, or however you want to summarize what you're reading. And so you want to stop every paragraph or two and make sure that you can summarize what you've just read, and that's the active part. In converting or translating the bio talk into your own talk, that's where a lot of good learning will happen. So as you're doing your reading and your active reading and taking your notes, you'll want to pay attention to the organs that are involved with each of the organ systems and what the primary function of the organ system is. So that's where I'm going to be expecting you to have some knowledge. And again, that's on your own. I do feel confident that you can make sense of that section of the book. It's not, it's not so overwhelming. So go for it, and I look forward to hearing and seeing how you do on that. Okay, so now let's get into the specific anatomical terms. So, in order to communicate effectively within the healthcare field and in this class, there are some very clear standardized terms that have very precise meanings that we are going to have to learn, that you're going to have to learn. And we use these to describe the body, to describe the parts of the body, the organs, the organ systems, the locations, the types of cells. And we use them to describe the location of these, especially in relative terms, in relationship to some other location in the body. And so a lot of the words, a lot of these precise words are derived from Greek or from Latin, and they and so the meaning is not always immediately clear. And so we'll spend a little time picking apart the roots, as we've already started doing in the previous lectures, making sure that you can look, that as you learn these roots, you'll have an easier time being able to interpret other words that use them. So the first thing, the first body position that I want you to be familiar with is anatomical position. And so take a moment wherever you are right now, take a moment and stand up and put yourself into anatomical position, because this is the position that we use for describing the locations of things, especially in relation to other body parts. So to stand in anatomical position, you want to stand erect, shoulders back, chin pulled in. Your hands and arms should be out to the side with the palms facing front and your thumbs away from the body. So we talk about the thumbs being lateral and the palms being anterior. Your feet should be relatively close together. I think probably just because of her body structure, she's got her feet set a little bit wider than maybe most people would for anatomical position. But the eyes, the nose, the palms, the toes are all facing forward, and that's an anatomical position. And using this anatomical position, and then a couple of other landmarks, we'll be able to start talking about positions and locations of things on the body. So when someone is standing in an anatomical position and you, as a caregiver or as you're looking at a picture, are looking at that person, you want to remember, because this will get somebody in the class this semester, because it always gets somebody every semester, so you don't want to mess this up. You want to remember that right and left are always from the perspective of the patient, not the caregiver. From the perspective of the individual in the picture, not you. So just be careful with this. So what that means is that this is the left side of the patient's body. This is the right side of the patient's body. So if you can remember patients first, that will help you to remember to keep that in mind. All right, so if something is above another thing, and here we are talking primarily in the trunk, so the abdominopelvic region, the thoracic region, the neck, and the head. If something is above, farther away from the ground than something else, it would be referred to as superior. If something is below something else, it would be inferior. So we could say that this woman's nasal area, her nose, is superior to that's cheek, to the oral region, the mouth. So superior means above. It's not a value judgment of like this is better than something else. It just means above, and inferior is not worse, it just means below. So we could say that the woman's umbilicus region is inferior to her sternum. That would be another, the breastbone. So superior and inferior. We can also divide the body front to back. And anything that is on the front side of the body is referred to as anterior. So the face is on the anterior surface of the body, while anything on the back side, the gluteal region, is posterior. And we could even say things like the nose is anterior to the ears, or the spine, which runs right here, is posterior to the sternum again. Okay, so anterior and posterior. And the roots, A-N-T-E, ante, that means before. So if you've taken Southern culture and you've talked about the antebellum period, that's the period before the Civil War. Whereas anything that's posterior is behind. So, the bum, we often tell children, sit down on your posterior. That's the backside. They have in humans the same meanings as the term ventral and dorsal. So the anterior is also known as the ventral surface, while the posterior surface can be referred to as the dorsal surface. So how can you remember this? The easy way, or the way that I think about it, and I think a lot of other people know this term, if you think about a dolphin or a shark swimming up close to the surface of the water, they have a fin that projects from the water. That is the dorsal fin. It's found here on the dorsal surface. So there, now we've turned into a dolphin or maybe a shark, and she is got that dorsal fin there on her dorsal surface. Where does the term vent come from, or ventral come from? It has to do with a structure called the vent that's found in reptiles like birds or lizards or turtles. It is a common opening for the reproductive system, the urinary system, and the digestive system. So it's the place where poop, pee, and eggs pass through, and it's referred to as the vent. And it's always found on the belly side of the animal. And so that term ventral means the surface that has the vent. All right, so ventral, anterior, they are the same. Posterior and dorsal are the same. If something is medial, it is toward the midline. So the midline is the very middle line that runs north and south through the body, from top of the head down to the feet. And anything that is closer to the midline is medial. Anything that's further away from the midline would be lateral. So we could say that the clavicles, that's the collarbone, are medial to the deltoid region, to the shoulders, because they're closer toward the clavicles, the collarbones, are closer toward that midline than the shoulder is. We could say that the ears are lateral to the nose. So lateral means toward the edges, medial toward the middle. Med is middle. Okay, so I said that we use superior and inferior when we're talking about the trunk, the head, the neck. When we want to talk about locations on the arms and the legs, we use the terms distal and proximal. And we always talk about these locations in relation to the point of attachment for the arm or the leg. So it's the shoulder is the point of attachment for the arms. The hip is the point of attachment for the legs. So if we're trying to compare the location of the carpal region, the wrist, to the humerus, that would be the upper bone in the arm, we would say that the carpals are distal to the humerus. Distal means further away from the point of attachment. So if it's distal, it is distant from that point of attachment. So the carpals are distal to the humerus, the upper arm bone. Proximal means that the structure being compared is closer to the point of attachment. So we might say that the patella, or the patellar region, is proximal to the digits of the foot, down here the toes. I missed that with my pen, but you know where I'm talking about. So the patella is proximal because it is closer to the point of attachment up here at the hip than the toes are. So this is always a confusing one for people. So when things are distal, they are distant, more distant from the point of attachment than the part that's being compared. So be careful with this. Practice in several different ways. I'm going to give you a practice questions in just a minute. Now, if we want to talk about the surface of an organ or the surface of the body and compare a location to the surface as opposed to being deep inside the body or deep toward the interior of the organ, then we use the terms superficial and deep. Superficial means up close to the surface, while deep, I think, hopefully that's pretty obvious to you, means deeper down. So we could say that the skin is superficial to the muscles found underneath. Or we could talk about the bones being deep to the skin. So superficial and deep are all about how far into the organ or to the body they are. Then last of all, the last term of relative position is to describe something as either axial or peripheral. So when things are peripheral, they're out at the perimeter. So if you think perimeter with peripheral, that means they're out toward the edges. While axial means toward the very center of something. So if we think of the axis of the earth, it runs right through the center of the earth. If we think of an axle, it runs right through the center of a wheel. So central versus peripheral. So we might talk about the spine as being axial, while the digits of the hands and the feet are peripheral. All right, so hopefully these terms of relative position make some sense to you. So how about we practice? I've given you three, and this time we're going to use another set of terms of relative position: bilateral, ipsilateral, and contralateral. And this is all describing our things on the both sides of the body. So if we draw a midline right down through her body, then if something is bilateral, it's found on both sides of the body. If two things are ipsilateral, they're found on the same side. And if something is contralateral, contrary, against, opposite, they're found on opposite sides of the body. So take a moment and pause the video and determine which of these things are bilateral, which of these are ipsilateral, and which are contralateral, and I'll show you the answers in just a minute. So really, I mean it, turn it off, do it now, and figure it out. See you in a sec. Okay, hopefully you did that, and now you have answers. Let's take a look and see if you were correct. So the eyes, the thumbs, and the nipples are all bilateral because we have eyes on both sides of the head, We have thumbs on both sides of the body, and I'm not going to draw in her nipples. That would be inappropriate, I think, but you can imagine that, of course, they are there, and they are found on both sides bilaterally. The penis of a male would not be bilateral. There's only one of them. The nose is the same thing, only it's not bilateral. Ipsilateral, remember that meant on the same side of the body, so of course her left arm and her left eye are on the same sides of the body. Were you thinking that was the left? Remember, left side, patient's point of view. If something is contralateral, they're found on opposite sides of the body, so this time the right leg and the left ear, hidden there in her hair, are contralateral to each other. So hopefully you got that, nailed it. If not, practice, think of some other things. Get your partner to stand in front of you, and you can point out things that are contralateral, or your child, or something like that. Enlist somebody, enlist your study partner, whoever, to help you think this through. All right, so if we are presenting you with images or pictures or whatever of slices through the body, we want you to be able to describe those slices, the body sections or planes, to you so that you can imagine what that really looks like. And the first body section that we can talk about is a sagittal section. This is a vertical slice through the body that would separate a right portion from a left portion. So you can see that slice of the plane running right through this woman's body. Now, if it happens to go right through the midline, as this plane appears to be doing, then we would talk about it as a mid-sagittal section or a median section. So a mid-sagittal section is a sagittal slice that goes right through the midline. Any other slice, so let's say if we made a slice that went through her shoulder, down through her nipple, and then continued right on down through her leg, the center line of her leg, that would be a parasagittal slice, a slice that is just to the side. And that's what para means, alongside. A paraprofessional, a paralegal, works alongside a lawyer. Okay, so that's the sagittal plane. Goes up and down. Notice the spelling, 1 G, 2 T's. That gets me most times, and so it might get you as well. The transverse plane is, on the other hand, a horizontal slice. And so it goes across the body. Transportation is porting or carrying something across a geographic region. So transverse means across. A transverse plane, horizontal slice. So we can take a transverse plane through her heart and lungs. I meant to get that higher, sorry. Through the heart and lungs. You could take a transverse plane like we're seeing here, right here, through the at the top of the pelvic region. You could take a transverse slice right through her legs. All of those are transverse planes. And note, by the way, that a transverse plane separates the body into portions, one of which would be superior. So here is the superior portion, one of which is inferior. So inferior and superior are related to the transverse plane. Then last of all is the frontal, sometimes known as the coronal plane. Frontal plane makes most sense to me because it separates a front from a back. Coronal means crown, and I'm not sure how that helps us at all. The frontal plane creates an anterior and posterior portions of the body. Or we can think of that as ventral and dorsal. And so you can make frontal slices through the body and then present the images that we're seeing. Perhaps a frontal slice that would only capture, like sort of open the belly up so that you can see the organs of the abdominopelvic and thoracic cavities, but not see the head and not see the legs because the belly kind of protrudes a little bit beyond those two areas. Okay. Hopefully that made some sense then. Sagittal, transverse, and frontal slices, sections, are made with these ways. So when you see images in the book, they'll make sense then. If we have an organ that is somewhat cylindrical, we can talk about sectioning it one of three ways. There could be a cross section. That is a slice that goes directly perpendicular at a 90-degree angle to the long axis of the organ or body that's being, whatever is being sliced, the cylindrical thing that's being sliced. If you choose any other angle, so here again, they've chosen this angle. So notice that this is not a 90 degree, not a right angle. So any other angle than 90 degrees would be referred to as an oblique section, because oblique means running at an angle. And we see this term in other parts of the body as well. So there are the internal and external obliques. These are muscles whose fibers run at an angle. So I'm holding my hands right now at an oblique angle. So my middle finger is right now, right at my belly button, and my palms are up kind of close to the ribs, and my thumbs are almost touching. So look at your hands now. If you've got your hands in that relationship, you'll notice that the fingers are running at an oblique angle to an up and down line through your body. So oblique means at an angle, and that's the angle at which the oblique muscles, the internal and external obliques, run at these kind of angles. And then last of all is a longitudinal, or sometimes called a long section. So that runs right down the axis of this cylindrical organ. So we can cut up organs this way too, and so just be noticing as you look at pictures that, okay, this is a cross section through whatever organ it is. Okay, some more terms that are positional. Here we're talking about how the body might be facing when it is laying down. So in the supine position, the body is in an anatomical position, but the anterior surface is facing upward toward the ceiling or toward the sun or the light, away from the ground. Notice that our dude here, I looked all over, I tried to find supine, pictures of people in supine pose with their hands facing upward as you would in anatomical position, and no dice. Here we have our, and I thought about taking a picture myself, but hey, nobody wants to see me laying around in just my shorts in anatomical position, so I decided that's not going to work so well either. And then when I went looking for pictures of someone laying prone, here's what I got. Again, we got some issues around anatomical position. Her face isn't directly downward, and her palms are now facing toward the ceiling when they should be facing toward the floor, but you still get the position. If your anterior surface is facing toward the floor, the posterior or dorsal surface facing toward the ceiling, then you are prone. All right. So let's now think about some regional anatomical terms. We've already introduced the idea of axial. Axial, the axial portion of the body relates to the head, the neck, and the torso, the thoracic and abdominopelvic regions. And so if we're talking about the skeleton, then the axial skeleton is everything there that is yellow in the diagram. Another term then is appendicular, as opposed to axial. Appendicular means associated with the appendages. The appendages, anything that you append, is something that is hanging on to. So the arms and the legs hang on to the body. They are the blue portions of the skeleton. So the appendicular skeleton includes the pectoral girdle up here, as well as the arm, and the pelvic girdle, as well as the leg. Those are appendicular. And then we come to the abdominopelvic regions, and there are 9 different ways. There are nine regions that we can slice the abdominopelvic area into, and then in the second we're going to show you a 4-sliced setup as well. And there are some name changes with this edition of the book over last editions of the book. So those of you who are working with the 13th edition, beware. I will be testing using the terms of the 14th edition. So the hypochondriac region. Now, I say hypochondriac, and probably most of you are going to think of somebody who thinks they're sick all the time. That is not the literal translation of hypochondriac. Hypochondriac, hypo means below, chondra is a root that relates to cartilage. This is the area of the abdominopelvic cavity that is below the cartilages of the ribs. So everything that is white here is not bone, but is actually cartilage. And so right here beneath the right hypochondriac region, we're looking at everything that is beneath that portion of the rib cage. The left hypochondriac region is similar. The epigastric region, epi means above, gaster, the stomach. So epigastric is right above the stomach, and here we have a portion of the body of the stomach is found in this area. This portion, there's a little bit of it that is in the hypochondriac region, but most of it is here in the epigastric region. Umbilical region, hopefully that makes sense. The umbilicus is the cord that carries, that has blood vessel in it, as well as some nerves in it that help to bring nutrients and some control to the baby in the uterus. So umbilical is all right around the belly button. The right and left lateral regions, and I didn't catch this until just the other day, and I haven't had a chance to update my slideshow, but lateral means there to the edges, so hopefully right and left lateral region makes sense. And hypogastric is no longer used either. Now we refer to this area as the pubic region. So sorry about those name changes that I did not catch. And then right here, to the left and right of the pubic region, are the inguinal regions. So this region right here, low in the abdominopelvic cavity, is the inguinal zone or area. And in men, it's especially important because that's a place where hernias can develop very easily. We'll talk more about why that is when we get to reproduction, very end of next semester. But the left and right inguinal regions are found low in the abdominopelvic area. We can also just make a big old X right through the middle of the body and divide the abdominopelvic region into 4 quadrants. Notice the naming: left, right, lower, and upper. And I will accept L-U-Q. I know that you know how to spell left, upper, and quadrant. So if you want to just give me L-U-Q, should I ask you this one on the exam, you're welcome to. R-L-Q, right, lower quadrant, and so on. So just pay attention and notice what are the organs that are associated with each of these regions. And that will be helpful to you. And then last of all, I want you to spend time with figures 126, A and B, to learn the anatomical terms for each region of the body. And so you need to be prepared to identify the regions by the anatomical term. I'm less interested in you knowing the common terms. So I'm going to ask you for coxal over hip. So ignore what this says. And I'm going to ask you for buccal over cheek. And that's how you actually say that. It's buckle, like a belt buckle, is how you say it, rather than buccal, which many, and me included, I used to think that that's how it was said as well. Okay, so there you have it. All that you need to know for Chapter 1 exam that is coming up. So study well. If you need to get a hold of me over the weekend, you're welcome to use my email address, and I'll respond, I hope, fairly quickly. I've been pretty good so far. And then, of course, you can see me in office hours on Monday, Tuesday, or Wednesday. So I look forward to seeing all of you soon. Study well. Have a great weekend. Bye-bye.